Hello, Kim.
Good morning. Good morning. Good evening to you, Reena, from the other side of the world.
It's always a pleasure to
Mm.
talk to you. Thank you so much for doing the work that you're doing and for bringing about a change in the lives of all of us as professionals and parents too. So, thank you
Mm.
for existing. So,
I want to
Kim,
say the same to you, by the way. Thank you to you for all that you bring to the families, to the clinicians, and to the beings around you as you continue to move in your mission of evolving the conscious evolution of the human spirit.
thank you, Kim. Kim, as we start, I first wanted to ask you, people want to know who are we? I mean, we are doing this mainly for 27th October. It's World Occupational Therapy Day. And who are we as occupational therapists? What do we do with children? If that's the question that anybody has in mind, I would love to know what do we do? How do we help parents or the clients or the kids? How do we bring about a change?
Mm. The word change is the interesting question. In my current reflections at the moment, with so much external stress in the world, there is an implication to the word change that we are moving forward. But I'm starting to realize that moving forward comes from standing still. And occupational therapists, our work in the world is to help people become their best selves physically, emotionally, mentally, spiritually. That our training is such a holistic perspective that we step into the lives of humans, for you and I, especially children, attempting to help them become who they are in the world. And that sounds pretty big picture, but it requires first that we are connected to what is happening in the moment. And I don't think anyone teaches us how to do that. We're always striving and attempting and wanting to get somewhere else other than where we are. And the power of feeling good about yourself comes from seeing yourself now. So I think as occupational therapists, we take skills, break them into small pieces, and help people find out what they can do and move beyond what they can't do.
Kim, I wanted to ask you one more question. You know, you learned straight from Dr. Jean Ayers, and I would love to know your views because now the kind of sensory integration that's practiced that parents know of is okay. I first do the swing, then I do the trampoline, then I do the ball, and if the child is not cooperating, I make him do, and I finish the task. Is sensory integration only about the body, or is it, as I know, it's the mind body. So, and if the child is not cooperating, I mean, of course, we use visual schedules, but is it not child led? Or is it just about this protocol that needs to be followed? I would love to know your views about the core essence of sensory integration.
Mm. Wow, my heart is full at that question. Mm. So I'm putting my mind in this moment to the moment of sitting on the floor in the Ayers Clinic at the age of, I don't know, 21 and watching Dr. Ayers treat. And as a young therapist, it felt like you had been transported into something magical because you could feel the oneness between Dr. Ayers, who I'm speaking about here, and the child. Her capacity to be present to the child was extraordinary. And it was the piece of the picture that we didn't always verbalize enough. Because every decision to do something, what piece of equipment to hang up, where to move the ball, how to hold her bat in the air so that the child could land their bat directly on hers, required a absolute state of magnificent present observation. So it wasn't ever, not 1 minute of it was a regime. It was a constantly attuned state of, I watch you, child, your movements, your breath, your facial expressions, your postural system, your color of your ears to see how stressed you are. And I choose a way of responding to you with the environment, with the task, and with my relationship to help you do something different than what you're experiencing now. This is artful. And nothing could be more further from a protocol than that. Now I get it. I get why people want to do things from a fix-it place. If we do this 100 times, it'll be better. Most of that comes from anxiety that my child is struggling, but also it's easier to just do something in a repeated way rather than to do something from an attuned way. It's harder to stay in alignment with your child and decide, on this bus right now, you need me to hold your hand in a certain way at a certain distance from my body while I soften my voice so that you feel safe with me. That takes a lot of responsivity to do that. I hope I answered your question.
Yes, of course. I mean, that was very helpful. It was helpful because, the kind of things, I don't know, maybe it's just my perception, but most parents who come to me, oh, he's toe walking, give me something for the toes. Oh, he's, putting a lot of things in his mouth, give me something around the mouth. Oh, he's running around, let me do a weighted vest. Meaning, I feel this is not sensory integration and this is not how we work. We just don't work with the symptom. We work with the child, and that toe walking, that oral, everything could be related to so many other aspects. So just a weighted vest, just an exercise is not sensory integration. That's what I believed, and I just wanted you to help me out with that.
I think there's one more piece to this, and it comes back to Occupational Therapy Day. Dr. Ayers was an occupational therapist. And sensory integration is a frame of reference of occupational therapy. And so it isn't just sensory integration that you're describing, it's occupational therapy that you're describing. When we use the weighted vest or an oral toy like a pill, that's the medical model that comes from that, give me something to take this problem away. And inherently at the heart of occupational therapy is not that. The problem-solving aspect is an aspect of our training. But as I spoke earlier, occupational therapists help children and parents be connected to the experience that they're having. I think it's very hard to hear that your child has a neurodiversity. And I chose that word instead of disability because it's hard to hear the word disability. And we as OTs walk with families on this journey of discovery. and shift them away from how do I just fix this to how do I support this situation so that my child feels safe and whole in the world.
Thank you so much, because that's what I really wanted to put across. It's not like, okay, like a pill, what you said is apt. I mean, thank you so much for that.
That is a humbling question. But when you create workshops, it's kind of like writing a book. It's your life's work. And instead of putting it on paper, was put it into video form. And our workshops at Relationship Matters are a blending of multiple interactive topics. And a couple of our favorites are trauma sensitive practice, autism matters, eating and feeding matters, sleep matters, becoming a behavioral detective, just to name a few. But those are the powerhouses, I feel, of the work that we've been doing over the past 2 years.